But we stop by to tell you that what's in front of you is bigger than what's behind you. Your destiny, your promise, your future. You might as well shout before you get it, because God sent me here to tell you that what he has for you is gonna be big.
I believe
that it's my season.
that it's my season.
You ought to declare that over your own life. Say, I believe
I believe
that it's my time.
that it's my time.
It's my time.
It's my time.
And I can feel it.
I can feel it.
Say, breakthroughs in the room.
Breakthroughs in the room.
It's yours if you want it. Anticipating. God's getting ready to move.
God's getting ready to move.
Listen, you ought to declare this over your own life. Say it.
For I know
God,
my God
he's working
is
a miracle just for me.
Just for me.
And it's gonna be.
And it's gonna be.
Listen, don't let negativity, doubt, or your haters convince you that God is not about to bless you. It's gonna be.
And it's gonna be.
What's in front of you is bigger than what's behind you. You gotta learn how to praise God before you get it. Say, I believe that it's my season.
It's my season.
It's my season.
It's my season.
And I believe that it's my time.
It's my time.
It's my time.
It's my time.
And I can feel it.
I can feel it.
Breakthrough, yeah.
Breakthroughs in the room.
I'm anticipating. God's getting ready to move.
God's getting ready to move.
Listen, say this with me. For I know God, he's working a miracle. And it's gonna be big. Hey, listen, I don't know about you, but I'm excited about my future. Why? It's gonna be big, yeah. I'm running into destiny, shouting into my promise. Why? God's gonna. I won't have room. Can't even try to explain it. God is gonna blow your mind.
to the Disciples of Jesus Ministries in Sickness and in Health COVID-19 edition. I am your host, Tangela Mash, registered nurse, and I am joined with three panelists as we're going to talk about COVID-19 and Corona and how it is actually affecting our communities, our lives, and our families. I'm joined with Dr. Amber Johnson, PharmD, Andre Mariah, LPC, and Dr. Ben Wiles. And I'm going to allow them to introduce themselves and give a little bit of a background of their work and their lives.
Hi, my name is Andre Mariah. I'm a licensed professional counselor and a counselor supervisor that's certified. And I work here out of retirement in Thomasville, Georgia, as a professional counselor and also as consultant.
Awesome. Dr. Wiles. Yes.
Okay. I'm Dr. Ben Wiles. I'm a retired pediatrician here in Thomasville, although I came out of retirement, and I'm now the medical director at Vashti.
All right.
Hello, I'm Amber Johnson. I am a registered pharmacist. I have been practicing in New York City for the last 12 years. And I also have my master's, and I've been practicing in the hospital location.
All right. Thank you all so much for joining and being a part of this panel today. We know that we living in a pandemic and these unprecedented times can be quite taxing on our communities and our families, and trying to deal with what we call our new normal is really hard. Ms. Mariah, as a licensed professional counselor, can you give us a little bit of an insight on how this is affecting those of our family members and friends in the community that have issues with, dealing with anxiety and depression and all this whole quarantine and being home? Can you talk to us a little bit about that?
First of all, let me talk from a personal perspective. I'm sheltered in and have been sheltered in since March. I know how to take care of myself mentally, physically, and emotionally. And it is stressful on me to be locked in by my husband in this house. But I have underlying health causes that prevent me from being out among people. I have several issues physically that I'm dealing with. And I know for the best part of it, I need to be sheltered in. But let's talk about the community in large. We have those who are living with anxiety. We have those who are living with depression. We have those who are spiritually wounded because they can't get the support that they need. As such, those things display themselves in our thoughts, our actions, and our feelings, and our behavior. So anxiety shows itself in physical symptoms, cognitive symptoms in terms of thinking, and behavior symptoms. You have people who are worried about their job security. They're worried about family and friends and being unprepared for the future. And then you have those kids who are walking into the uncharted place of going to school, not sure what they believe because they live between the truths that their mothers and parents teach them and their own personal truth. And so they're mixed emotionally because they don't know how to express themselves because they're torn between what they see in the news media, they see what their friends are doing, and then they see what they're being presented with in the homes. So that's a confusion for them. Anxiety comes about with the lack of concentration, feeling hopeless, restless, muscle, all the physical disabilities, fatigue, and most of all, a lot of anger. People are very upset about someone else choosing their thinking and feeling. How dare you tell me to wear a mask? How dare you tell me that I can't mix in a crowd? And then you have those individuals who say there's nothing wrong. Everything is fine. And the decor of our society now is so mixed, so torn down. We're just living in a world of uncharted waters again. And as a result, people are behaving differently in all of those sectors.
Yes. During these times, do you feel that we in our community, are there more people seeing assistance with their mental health? Like even people that have never had any issues with anxiety before, never had any issues with depression, are you starting to see an influx of that more in the community? And do you recommend people to seek out, a counselor, someone to talk to, someone to, share their thoughts and their feelings with during this time?
People have circles of influence in their lives. Counseling today is not the same as it was years ago. You're going to have folks who have ambivalency about going to see someone who calls themselves a counselor, whether they are licensed or not. So what I look at is the whole community working together, help that person to become whole. I'm on the board with mental health, and we have seen a lot of changes since COVID. We've had to change our program structure, how we do business through telemental health and things of that nature. So to answer your question, yes, I think people need to seek help, but I think they need to have a circle of support. You got to have relationship with people who they trust, people who they believe that can be there for them. What I'm most concerned with is that we're missing our children. We're so concerned in our own lives that we're not realizing that they are impacted more than we are in so many different levels. And so they need a place where then they can unmask and feel what they feel and be okay feeling it and talking their truth. I don't think we're listening enough to what they're going through right now because we're so concerned about all the issues in the world. So I think that it needs to start from a spiritual perspective. I think that the church has its work to do. I think the family needs to work together. And I think that what we lose there is that we don't find ourselves sensitive to their own stress. Parents need support as much as kids do. So everyone working together, we can do this, but we got to realize there is a problem, and that's where we're divided. There are those who do not believe that COVID-19 is real. And in the communities, when you go out, you don't see masks. You don't see adults doing what they need to do to show our young people that this is a serious illness. This is a serious disease, and it can certainly hurt people. So I think that we need to have a call to order, some sense of balance where we do something that can help our young kids. My daughter is a licensed therapist in the state of Florida, and she came out with this curriculum called Unmasking Your Full Potential, Your What's Next. And it's for kids. It's all about how we can help young kids to say, hey, yeah, I am scared to go to school. Oh, no, I don't want to go to school. And we need to be there in some kind of way to, okay, if you don't want to go, these are the things that might help you to be safe or to feel safe. And the first thing we need to do, mask up. That's the answer. Mask up. I'm serious.
That's right.
We got to walk the walk and talk the talk. Those physical symptoms of being sick, those symptoms of having crazy thoughts, anger, all the outbreaks that we're seeing going on, aggression. We have so much abuse that's going on, and we're not paying attention to it. And a lot of this has to do with COVID. So if we can stop and realize our whole world is traumatized right now, we're in a state of trauma, that we got to do some informed care on how we can help relieve that in our communities. And it starts with admitting we have a problem.
You're exactly right. Being able to admit that there is a problem, and we have the power to do something about it.
Exactly.
We all have the power to do something about it. Thank you so much, Ms. Mariah, for those great words, and I hope that everyone that's joining us will take those words to heart. Any other words? Yes.
One thing that I like to say: taking time away, walking, getting away with quiet time, music, relaxation, reading, breathing. 10 minutes a day, just getting up, moving around, getting out. I do a lot of shots of nature, going out, taking pictures. I journal a lot. I think that those are the kinds of tools that we can get our kids involved with. Okay. So we need to realize that they need to de-stress, help them by planning some activities that will help them to use what they have to find a way to express themselves other than being angry or depressed or separated. Thank you.
You're exactly right. Resiliency is key. We need to find ways to be resilient. We know that studies show that exercise really helps boost the mood and helps decrease anxiety and depression. So, we're not saying go out there and run a 5K, but get out there and walk a little bit, get some fresh air in your lungs. And definitely want to make sure you're masking if you're around people, but take a short walk, get some fresh air, listen to some great music, find a different book. You're right. Magazine, something that is light, staying away from the news.
Number one.
Find some really good things on things that make you laugh and make you feel very light. There's a few things that I found that are very helpful. So thank you again, Ms. Mariah, for your words. We appreciate that. Thank you. So Dr. Johnson, as a PharmD, what do you find that are some great preventative measures that we can take to, boost and make sure that our immune systems are well enough to handle, not just only the coronavirus, but any type of viruses? What do you think is best? What are your thoughts about that?
Well, you said it correctly. It's not just the coronavirus, but if you are battling any sickness, if you want to have a great immune system, the first thing you want to do is make sure you're healthy. So that includes staying active. I know it's a bit harder with gyms being closed and things of that sort. So you mentioned walking, running. If you want to do any type of outdoor activity, bicycling, also making sure you're wearing your mask during those times. But also, even if you're not working out or doing anything outdoors, then you can actually access some home exercises. You can access social media, has a lot of different apps or different platforms where you can actually do different exercises and routines. So that's the first. Stay active, stay hydrated. It's hot too. Outside of COVID, it's excruciating outside. So staying hydrated is important. Also maintaining a balanced diet. That's fruits and vegetables. All of these things that we would normally try to do or maintain just outside of COVID. It's just vital to actually do that now. Fruits and vegetables. And if you're not, I guess, saying eating appropriately, and if you're more so, fluctuating between fast food and, eating a balanced diet, then make sure you're supplementing with multivitamins, vitamin D. If you have, a lot of African Americans, they have low levels of vitamin D. So if that's something that you assessed or your primary has told you about before, making sure that you have those supplements that's going to balance your nutrient threshold. Outside of that, you want to continue to be advised on the preventative measures that you can do to not contract coronavirus. So that includes hand washing. That includes if you don't have access to soap and water, then you also make sure you use hand sanitizer, at least 60% of alcohol, as well as using your mask and social distancing at the same time.
Yeah. Thank you. Yeah, we know that those are great. Yes.
One more thing I want to mention, because also I know with maintaining your immune system, there's some adults, individuals that have different disease states, whether it's high blood pressure, diabetes. And if you are affected by coronavirus, there's a possibility of severe illness from that. So a lot of that is maintaining your current conditions, making sure you have access and you're taking your medications as appropriate and as prescribed, thinking about not only, if you're taking your medication as prescribed, as well as making sure you're vaccinated and up to date with all of your immunization schedules. So all of that factors into making sure you're healthy, making sure you're just maintaining your immune system.
Great. Thank you, Dr. Johnson. Yeah. So in saying that, Dr. Johnson, you mentioned, making sure that we're wearing a mask. There was a question that stated, if you're wearing a mask, is it still important to remain 6 feet apart?
Short answer, yes. The mask isn't foolproof. Let me just talk about the recommendations. The recommendation from the CDC is to, when you're outside, use a cloth mask, as well as other preventative measures. That includes, as I mentioned before, hand washing. That meant it also includes, like I said, using sanitizer as well as social distancing. With that, what it is the masks are to prevent you from if you're infected from infecting other people. Now, if you're using this mask, I know everyone has one, but on the sides there's potential openings where droplets, if you sneeze or whatnot, there's not that it's fully positioned. There you go, Dr. Sam. If you sneeze or cough, it's not necessary. And not everybody has the mask.
They're pulling out their mask. I see them.
Yeah, but the thing is, it's not foolproof. So there's opportunity for droplets to go through the mask, and even if you're wearing a cloth-based mask or a cloth mask, what it is if you're not knowing if you sneeze or if you cough, what's filtered through, and if it's strong enough to not have filtered through. So the recommendation is to make sure that, outside of just the mask, you social distance as well.
Yeah. Yeah, there's a question in the chat from Sabrina Everett. Our personal air purifiers, such as the electric masks or purifier necklaces, good ideas. I don't know that I've ever heard of a purifier necklace. That's new to me. I've never heard of that.
That's a first for me, and I'm a healthcare professional as well, as far as a purifying necklace. Honestly, I'm not familiar with an electric mask. I'm familiar with what the recommendation is. The recommendation is a cloth mask. You use that mask on you, and the thing with the purifiers, honestly, I just look based. I wouldn't say it's wrong, but as far as it being effective and what the recommendation is, I would just go with the cloth mask as well as the social distancing. I can't really speak to whether the purifier would actually, be effective. I mean, in the grand sense of things, possibly, but the recommendation is the cloth-based mask.
All right, we have another question, Dr. Johnson. If wearing the face shield, if you're wearing the face shield, so should you also wear the mask? And I've seen people wear both. I've seen people just wear just a shield. Some people don't wear the shield; they just wear just the mask. But if you have the shield, do you need to put the mask on as well?
Well, the shield it's a shield for mainly your face, but the mask, like, I guess I'm trying to understand, like, the shield doesn't
It's
really
what Andre has, what Ms. Mariah has. So that's the shield. So I've always thought that if you wear the
Go ahead. Is she frozen? Hello? Sorry, you were frozen for a second.
I'm sorry. So with the shield, how can the droplets may be able to still get in if you don't have a mask over your nose? I thought the shield was more for your eyes or.
Right. Usually the shield has been recommended to be used in the healthcare setting. If you're in a hospital, if you're dealing directly with patients that have coronavirus, it's recommended that the healthcare provider use a mask as well as the face shield, mainly for protection for your eyes. Like I said, usually when you're outdoors, and I know people are taking the necessary precautions. If you like to use a mask as well as a face shield, then it's fine. But the recommendation is just the cloth mask.
Great. Thank you so much, Dr. Johnson. Dr. Ben Wiles, I have a question for you. So, can a person with a positive coronavirus test result but no symptoms spread the virus to others?
Yes. If you're not positive, if you have a positive test with no symptoms, you still can spread the virus. If you have a lot of symptoms, you're just going to spread the virus more quickly. Unfortunately, a lot of people without symptoms don't feel they need to put a mask on or anything because they don't realize that they have it. And so everybody's mentioned about wearing masks. I commend you for that. That is an important thing. I will give you one other point where you might consider a face shield. We know that children, small children, don't do very well with masks, and in fact, they're not recommended. But I can tell you, my 6-year-old grandson, if he goes back to school next month, will be wearing a face shield. And I think that would be something. And he may even have the mask. And speaking of masks, one of the things that I'm recommending for my family and friends and people I talk to is this might be a great time to have your children who've been quarantined at home to practice wearing their mask all day at home, so they get used to it and they're less likely to take it off in school. The COVID-19 issue is real, as Andre pointed out, and unfortunately, we have people who do not believe that. Well, there are people who don't believe in gravity, but you jump off a building, you're still going to fall. The use of the mask is such an important thing that we can do that's simple that will help stop the spread. And by the way, I have a mask here. When I go out and I see people put their mask on and they wear it like this, they absolutely, when you expose your nose, you don't have a mask on. All that is a chin strap. Wear the mask properly. It should cover your nose and mouth and should be fairly firm around the cheeks. And also, if you have the option of with the face shield and wearing a mask, I do both, because every little bit will make a difference.
All right, thank you. I have a question from Mr. Lorenzo. Is it truth or a myth that the virus can enter through your eyes?
That's true.
It's true.
Absolutely. The virus can enter through your mouth, your nose, and your eyes. And that's why it's so important not only to wear the mask, but another thing I haven't mentioned before, but I'll emphasize it now. That's why we want to be doing this hand washing, because we touch our eyes, we touch our mouth, we touch our face, and we touch inanimate objects where the virus is lying. And you take that, you touch something, and you put it in your eye, your mouth, your nose, you've got the virus. So, yeah, absolutely. Hand washing is a key essential.
Yeah. Yes, we totally agree. Another question, just to follow up on the last question about not having symptoms. If you test positive for coronavirus, you don't have symptoms. There was a question: is it okay to continue to go to work if you're wearing a mask?
Well, I would say this: if you have somebody who's wearing the mask perfectly, has taken all precautions with it, and it's absolutely, there's a chance he won't spread it. But nobody's perfect in this. So my feeling, and I think the recommendations, if you're positive for COVID, you do not go to work. You do not get into the social crowds. It's you're a high risk for other people getting the disease.
Thank you. Thank you. Any other questions from our chat? Any other questions from anyone? All right. So Chandra Blake, is the virus only airborne, or should we still be concerned with surfaces? It being alive on surfaces. Yeah. Dr. Weil or Dr. Johnson or Andre?
Yes, you still should be concerned with surfaces as well as being airborne. That's another way. That's another reason why they say or advise, if you're going out, be mindful of, if you can't hand wash, use hand sanitizer, use wipes that contain, like I said, at least over 60% of alcohol, because you do touch these surfaces. And then those, some studies say that it can be airborne for 3 hours. The others say that it can be on surfaces for longer. So the recommendation is definitely, like you said, when you go out, not touch too many surfaces at all, especially children. I know one thing is being mindful of being out with your children, and they're running around. It's like during these times, it's really one of a good idea to make sure your children aren't touching too many surfaces. I actually saw that maybe a week or so ago. A mother was with her 2 children, and she was trying to help one, and the other one was end up going to a door and touching a door and opening it, and she was just like, oh my god, and she had a wipe, and she just took the child's hand and just started wiping profusely. So Yes, it can definitely be on the surfaces as well.
Yeah.
Absolutely.
So we definitely need to be careful. It's always a great idea to I keep extra masks in my car. I keep them in my purse. I keep hand sanitizers in the car in different places because you know we always want to be safe. You want to make sure that you're taking the precautions for yourself so that we're safe when we're around other people, right? Any other questions from the audience? Any other questions from the chat? Any other question for our panelists here?
I just want to mention something about masks as well, especially if you have the cloth. Regularly clean it. It's not one of those things where you have a mask and you wear that forever, and you might do it every once or twice a week. Definitely clean it. They say the recommendation is after every use. I know that might be a stretch or difficult for daily, but that's the recommendation there, to make sure you regularly clean if you have a cloth mask, as well as if you have one that's more surgical, rotate it and throw it away.
Oh yeah. Yeah, you have people that are wearing the same mask for weeks and don't think that. So what do you recommend for the cloth, for the mask, that the blue mask that people wear? Maybe like once or twice and then toss, maybe? Or if it's really wet and soil, you definitely get rid of it. What do you think, Dr. Johnson?
Honestly, if you have the means, after every use, throw it away. If not, then as frequent as possible. That's what I would just say. Like I said, if you have the ability to dispose of it on a frequent basis, after every use, dispose of it. If you can clean every day, and especially the often, try to do that as well, or hand wash it. That's okay as well.
Don't limit
All
yourself.
right.
Don't limit yourself to one cloth mask. We have about 15 masks, so we rotate, and that way you always have a clean mask. And so, and you could, again, mask is an issue for anyone. You could make a mask out of a old sock. I mean, it's all kind of no excuse out there to get masks and clean masks. So, okay.
Exactly. And we
And
see,
Tangela,
yes.
let me speak to the shield again.
Okay.
You have young kids, just like Doc said, and I'm speaking about the fact that the shield, you have young people, especially kids who suffer from being closed in. You know, they suffer from anxiety. To be able to see is really important. And if a kid has a preference, I think they should do just like Dr. Ben said. I think that you should make sure that they have what they need to feel
I
comfortable
agree.
and protected. So, now believe it or not, I suffer from claustrophobia. I'm claustrophobic, and I know that. And so being covered up is not what I do well. And so I have both, because I told you my husband is extremely sensitive to this. So I will wear both, and he'll tell me to mask up, and I carry both. Now, an incident the other day, I had dental surgery. I walked into the dental office with my shield, but I had my mask in my pocket. And the nurse said very clearly, "We prefer masks." So I gently set it aside, and I had my mask. So I think that we need to have what we need for what the environment is. But I think my daughter prefers me in she said the droplets, this ain't gonna do nothing. And I said, hey, I admit that. It won't do anything if it's not gonna protect what needs to be protected. So we need to be sensitive to both usage of what's important. And let's be real sensitive as it comes to the kids, because you have so many people that have breakouts from masks.
Yeah. Oh, we have something in the chat from Dr. Latoya Davis. Am I immune from the virus if I've already had it and now I'm symptom-free, virus-free? So if you've had it, are you immune from ever getting it again?
No.
You can get it more than once. Plus, there's mutations going on. So you can't say because I had it once, I will never have it again. This whole area is still research. We don't have all the answers, but I would definitely recommend that you not feel that because you have the virus, you're home free and you won't infect other people because you certainly can. You may not have symptoms again, but those other folks may get it.
All right. And so for Pamela Drew put in the chat, she wants to know what symptoms should we be looking for? What are your some of the symptoms that you see for coronavirus COVID-19?
Everything from cough, headaches, loss
Fever,
of smell, sore throat,
appetite.
appetite. It could be varied. Unfortunately, I have a sister who had only the symptom of a sore throat for a couple of days. She went to her doctor because she thought she had strep. She was positive for COVID and had no other symptoms, and the sore throat had gone away. So
Yeah.
it's a myriad of symptoms. Those are the most common ones we mentioned.
Yeah, I think that, like you said, it's such a broad array of symptoms that, if you feel that there's something wrong, go get tested, go get tested.
And shortness of breath is another major one I should point out. Shortness of breath.
Yes. And muscle aches. All right, so from Michelle Johnson, someone tested positive 3 times. She said that her doctor said that she is not contagious and that she can go to work. The doctor said that she didn't have any antibodies of the coronavirus. Is this correct?
No. I won't say which.
Yeah, she tested positive 3 times. So
and he said she's not contagious and you go to work. I absolutely disagree with that. First of all, the test, what test did she have? There are some tests, we have some problems with some of the testing with false positive and false negative. But if she's had 3 different tests that are positive, then she likely has coronavirus and certainly should not be going to work, should not believe that she's not contagious to other people. So
yeah, most definitely.
Well,
yes, if you're
sorry, go ahead.
Go ahead.
Usually your places of employment, and depending on where you are as well, if you're not working remotely, they will be asking you questions regarding if you've had exposure, if you've had the test before coming back to work. I know I'm in the healthcare field, so that's definitely a requirement as far as reporting on if you've traveled, if you've been exposed, if you tested positive, do you have antibodies? Those are some of the questions. I mean, it may not be in every case, but usually the employers are going to encourage you to stay home. That's the hope, so it won't be spread.
All right, thank you. And from Alice Bentley, she wants to know if you've gone out, you've been out and about. When you come home, should we just, take our clothes off and shoes off immediately and get them into the laundry, or is that something that we don't have to worry about doing? What are your thoughts?
I don't honestly. If it depends on the setting that you're working in. If you're working in a hospital, if you're being exposed to patients or people that have been exposed to COVID, then I would try to have a change of clothes and actually not try to bring that into the house. Or try to dispose of it prior to. I would have a change of clothes for work and a change, and have different when I'm getting off. If you're just regularly going outside, social distancing, practicing safe precautions, I don't feel it's necessary that you have to immediately wash your clothes. Like I said, it really depends on your exposure. If you do feel that you've been exposed somewhat to COVID, of course it's important to wash your clothes immediately, wash your hands immediately. But in the grand scheme of things, if you're just going out grocery shopping, or whether it's going out for a walk and you come back, it's not necessary for you to have to immediately wash your clothes.
Okay. All right. Dr. Wiles, you had something to add?
I was just going to point out one thing, again, my pediatrician habits here. We're recommending, at least again, to my family and friends, that our children, especially as they go back to school, our kids have Crocs. And when they come in, those Crocs, they don't wear the shoes in the house anyway, but those shoes are taken off and easily washed, as opposed to, your regular tennis shoes and that kind of stuff. So Crocs would be a good idea at this time.
All right. Okay, Chandra Blake says, what advice do you all have for educators as they're preparing to return back to school? We know that this has been a hot topic all over the news. There's so many different debates. Should they go back? Should they stay home? If they stay home, how are the kids going to learn? The kids need to have lunches so they can go back to school. As these educators, there are some teachers that have to go back. What advice do you have for them as they're returning and going back to school? Hi, Andre, you're still muted, I think.
Okay.
Oh, there we go.
First of all, they need to feel secure within themselves and be clear about what they feel about this situation. Because right now, I'm working with some educators who don't feel very comfortable about it. It's kind of a mandate they got to do, but they're really not convinced that this is the right thing to do. Kids are very sensitive and they realize that they can sense that more than you give them credit for sensing it. So I think that the teachers themselves need to be clear.
Yeah, there's some feedback. We got some feedback from something somewhere. Yeah, somebody's tapped into the actually has gotten in on our live.
Explain to me what a friend is. If somebody come at your door and knocking, you don't open the door and say, "What you coming at my house this time of night for?" This time of night.
All right, so yes, that somebody has gotten into the actual feed. So we're going to allow Joel and that crew to actually work on the audio and on the back end. All right. Are we good now? All right, Andre, thank you. So if you will, could you continue?
I said, first of all, let me restate that I think that the teachers themselves need to be clear about their own position on this situation. And my reason for saying that is because they are the tools that the kids use for instruction. So if the teachers are uncomfortable, I think that that's going to go over to the kids. So I think that the teachers need to be prepared. As I talked to an educator the other day, she said that she's going to make sure that she has her mask. She's going to make sure that she has disinfectant. She's going to make sure that she practices what she preaches. She's going to use both. She's going to clean her room every day after each class or intervention that she has. And then she's going to be responsible for herself and making sure that she herself practices those things. So I think that's from an educator. That's not Andre. That's someone who's in the classroom on the front line every day who is saying that. And also she's going to try to encourage other educators who are teaching to do the same.
Awesome. Yeah. I think that those are all great things to do. And I'm sure there's a lot of anxiety around it, especially those educators and teachers that have underlying conditions. We know that children love to love on you and hug on you and come in and say hi. And, but we do know that, they can carry things with them, So, you want to be mindful of how are we going to engage with your students now? How are you going to actually, children love to play and come in contact with each other. And that's who we've always been as social beings. But being able to navigate this in your classrooms is going to be, a new task for these educators and teachers. And we appreciate you guys for all that you do for our children. Thank you. Jacqueline Lawson, it has a question. She says, how do you advise parents and students on personal health and backpack cleaning? How often? I don't know that we have any guidelines out there. I think this is a great question. I don't know that I didn't see anything on the CDC website about, backpacks and cleaning of educational materials. But I think that is something that they may want to do on a daily basis.
I'm going to hone in on that again. I think that, first of all, there needs to be a conversation between the parents and the teachers. And I don't know how they're going back to school and tell them whether or not they're going to have the workshops where the parents and the teachers talk. Because sometimes kids can be offended very easily about how you treat them and what you do. If you grab a kid's backpack and start spraying, that could cause some really issues. And I'm really child sensitive. So I think it's important that the parents understand the need for that to occur. But I also, if a teacher is desiring to do that, it should be something that is spoken with the parent and the child, so that there is no misunderstanding that this is a practice that is healthy. It's not a message to you saying you're not doing something, you're not clean, you're not practicing. I just think that we need to be very clear and deliberate in what we're doing.
Yeah, and thank you, Andre. And from Sabrina Everett, she states that please remind the educators to be mindful of children who have asthma when we are using the spray and the disinfectants. Any recommendations from the doctors here about that? We know that kids have, just like adults, kids have underlying conditions as well. So we do need to be mindful of that.
I think with that, with how there's action plans and things of that sort for children, being aware of what possible triggers children with asthma have, and actually, having a preparedness plan on going back to school, especially with that sensitive issue. Just because, of course, disinfectants are going to be needed and things of that sort. So hopefully the parent and the teacher will have a conversation, or there's a plan in place that we put in place as far as how to manage those patients or those children with underlying conditions.
So make sure that those children who have underlying issues are identified. Teachers and others are aware of that.
That is very important, to know your children, know the educators, know who your asthmatic kids are, those kids that have diabetic kids that are in the room, all those that have different issues. It's good to be aware and to know that some of the issues that your children have, and to talk to the parents about that. Amazing questions in the chat. Any more questions from our audience? I understand that Andre Mariah, she's not, you don't see her right now. She had to go. She had another engagement, but we want to thank her for being a part of the panel. Amazing insight. We appreciate that. Any other questions from the audience, from the viewers? Well, at this time, I want to thank Dr. Johnson and Dr. Wiles for being a part of this panel today. And I want to give a big shout out to the Disciples of Jesus Ministries for, creating this platform. I mean, this is so needed. And to see that this is something that we need to talk about, and having this panel of healthcare providers and allowing the viewers to bring in and have questions is so vital right now. We need to have these conversations. We need to have these chats and these talks so that we can be more prepared and we can live and be strong and get through this pandemic together and alive. So again, thank you so much. And I personally want to thank you for allowing me to be a part and to host and facilitate. It has been absolutely my pleasure. And we look forward to the next in sickness and in health. Is it? Thank you.
Awesome.
All right.